Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, It's Flu Season, Just Say No, presented by Dr. Kevin Porciuncula, family medicine physician with Washington Township Medical Foundation. Dr. Porciuncula is board-certified family medicine physician. In addition to family medicine, he has 2 additional board certifications. He is board-certified in obesity medicine by the American Board of Obesity Medicine and lifestyle medicine by the American Board of Lifestyle Medicine. Please welcome Dr. Porciuncula.
Thank you so much. Thank you to the Washington Healthcare System and the Foundation for inviting me to discuss this very important topic, especially as we enter the winter season. So let's talk about the flu and how it impacts you, your family, and your loved ones. So let's do everything we can to try to prevent the rates of flu and just say no. So what I'll do is I'll discuss the impact of the pandemic on recent flu rates, statistics and financial burden of flu, influenza virus, the basics, flu versus cold versus COVID-19, and prevention. What can we do in terms to prevent the rates, such as flu vaccine, which is vitally important, as well as everyday preventive actions to decrease these rates. And I'll take some questions at the very end. So let's look back at the last 2.5 years. As you might recall, the World Health Organization declared COVID-19 a pandemic on March 11, 2020. Since that time, we have been washing our hands, we have been wearing face masks, we have been social distancing, we have been remotely working from home and staying at home when sick, and we have been getting our flu vaccines and boosters. In the last 2 years, the flu rates have been dramatically low as compared to previous rates. But now, as the mask mandates have been lifted, restrictions are no longer in place, people are getting back into their pre-pandemic activities. They're going to football games, going to restaurants without wearing a mask, and attending to their everyday activities with less restrictions. We have to be worried that the flu season could be increasing and could be causing what we call a twindemic. Remember that COVID-19 is still around. It's still here. Every single day, it causes roughly around 400 deaths daily in the United States. And with that, and with the mask restrictions gone, these rates could skyrocket, especially with flu and all the other viruses as well. So let's go to a little bit of statistics. By the numbers, did you know that 9 to 41 million cases of flu have been reported every year? And that's since around 2010. Around 3% to 11% of the US population will get the flu each year. And 140,000 to 710,000 Americans are hospitalized each year due to complications. Roughly, there are around 12,000 to 52,000 deaths per year. In some statistics, shows up to 62,000. But these are reports from the CDC. And the World Health Organization reports around 291,000 to 646,000 people worldwide die from seasonal influenza-related respiratory illnesses each year. Last year, 2021 to 2022 flu season, preliminary data shows that around 5,000 to 14,000 died from influenza, and 82,000 to 170,000 were hospitalized. And these decreased numbers were basically due to the mask wearing, the mitigation factors, the COVID safety measures that we have been doing for the last 2.5 years. The financial burden of flu, it costs roughly $10 billion per year spent on hospitalization and medical visits, and around $7 billion estimated cost of sick visits and lost productivity. Before I talk about the flu, I just really want to stress that because we're no longer wearing masks, less people are being as cautious as they were in the last 2 years, the flu rates can go high. If we look at like in Australia, in the southern hemisphere, recent reports have indicated that they have a peak amount of flu rates as compared to the last half decade. So we have to do everything we can in order to prevent the flu. So the flu basics: flu is a virus. It's a contagious respiratory infection caused by the influenza virus that affects the nose, throat, and sometimes the lungs. Just like cold, just like COVID-19, it spreads through the air via respiratory droplets or touching surfaces that has droplets and touching your nose or mouth or face. And what a mask did was it prevents you from touching your face. Now, there are 4 types of flu viruses: influenza A, influenza B, influenza C, and D. Influenza C is a milder form. It doesn't cause epidemics. D does not affect humans. But what we are concerned about is influenza A and B. Influenza A is example of this is H1N1, which is a swine flu that was that had a peak incidence, especially in 2009, and H5N1. Now, the current FDA licensed vaccinations here in the United States protects against 2 influenza A viruses and 2 influenza B viruses. All vaccines here in the United States are quadrivalent. Okay, so they protect against 4 different strains: influenza A, specifically H1N1, H3N2, and 2 influenza B strains, which is the Victoria strain and the Yamagata strain. So why is it important that we talk about this? Because it can cause mild to severe illness and complications that can lead to hospitalizations or death, and particularly in high-risk groups. And these high-risk groups, as you might know from the last 2 years, are adults greater than or equal to 65 years of age, children less than 5 years of age, and particularly less than 6 months of age, because the vaccines are not currently licensed for less than 6 months of age. Pregnant women. When women are pregnant, it causes changes in their immune system. It causes changes in the heart and the lungs. They're so more predisposed to having infections that can be severe. As well as immunocompromised individuals, those who have COPD, asthma, diabetes, chronic kidney disease, those who are taking immunosuppressant medications such as steroids or prednisone, and those who have cancer. Going back to the basics, what are the symptoms of the flu? If you've ever had the flu, it can knock you out for a few days. So these are fever. It really causes a spike in fever, cough, sore throat, runny nose or stuffy nose, fever, muscle aches, headache, or fatigue. Now, is the flu the same as the cold? It's not. The cold is caused by more than 200 viruses. Most common would be rhinovirus. It can be caused by parainfluenza virus, other types of coronavirus, or enterovirus, or other viruses. So usually the cold is mild. If you've had a cold, you might be, have a stuffy nose, cough for a few days, but that's pretty much it. It's pretty mild. But the flu is a lot more abrupt. The symptoms start pretty suddenly, and you'll feel it right away. How about flu versus COVID-19? So the thing is with flu versus COVID-19, you really can't tell the difference in terms of symptoms. They pretty much present the same. So it's hard for me when I look at a patient to say that you have flu or you have COVID-19. One of the symptoms that might be different is that in COVID-19 here, based on the NIH, many patients actually could have a change in or loss of taste or smell. That's pretty unique to COVID-19. But in terms of the differences, COVID-19, in terms of incubation, flu, if you are exposed to someone with the flu, it can take roughly between 1 to 5 days for symptoms. But with COVID-19, it can be anywhere from 2 to 5 days or even up to 14 days. So that's why initially when the COVID-19 outbreak first was discussed, they always said to quarantine for a longer period of time. And also, one of the questions is, can you have the flu and COVID-19 together? And it's definitely possible to have both at the same time. It's not common, but if you do have both COVID-19 and flu, then the symptoms can be a lot more severe and the complications could be a lot more severe as well. So the heart of this discussion is really what we can do to protect you, yourselves, and your loved ones from contracting the flu. The best way to protect yourselves and your loved ones, your family and friends, and our community is really by advocating to get your flu shot. Who should get the flu vaccine? Everyone 6 months of age or older should get the flu vaccine, with some rare exceptions. When should you get vaccinated? The flu season is, CDC says, flu season is around September to May, sometimes until June, but the peak is from December to February. So right now, it's when we're videotaping this is October, so I do recommend everyone to get your flu vaccine right now. And the flu vaccine usually the immunity lasts for around 6 to 8 months. How often do you need a flu shot? It's annual. So it's annual because every year these viruses, they change these viruses have a protein and they can mutate and they change, the strains can change, and that's why every year we need to get these flu shots to protect ourselves. Now, how safe is the flu vaccine? The flu vaccine is very safe. The CDC and the FDA have a robust safety profile on the flu shot. There are a lot of studies done on the flu vaccine. This has been around for a long time. This has saved a lot of lives. If you have any questions about the safety, you should be reassured that the CDC goes through, all of these are, they go through a phase trial, but then every year the CDC implements side effect reporting, such as the vaccine adverse effects reporting system, where patients, if they have any side effects, they can report it to the database, and that's analyzed every single year. But in general, the flu vaccine is very safe. It does not cause flu, and I'll get to that. Now, what are the common side effects? The flu, just like any vaccine, can cause some soreness, redness, or swelling at the site. And less than 1% can have a fever, chills, muscle aches 1 to 2 days after injection. And for me, many times when patients have those symptoms, I tell them that it means that your immunity is working. Your body is starting to build up that antibodies so it can fight off the infection. Now, one of the biggest questions that I get, or one of the biggest things that my patients report to me, is that last year when I got the flu shot, I got the flu. Now, is that true? It's a common misconception, actually, that the flu shot gives you the flu. Now, it's not possible that the flu gives you the flu, because the flu itself is made from a killed virus. It's killed, it's inactivated. It doesn't have the antigenetic properties. It doesn't have the ability to cause flu. And it's also, there's another form which is called flumis, which is attenuated or weakened virus. It's not able to reproduce in our body due to our body heat. So real quickly, there are 3 types of vaccines, 3 general types of flu vaccines. It is the inactivated egg-based vaccine, the recombinant DNA-produced vaccine, as well as the attenuated live vaccine. And before I get to this, the FDA currently in the 2022-2023 season, there are currently 9 FDA-approved vaccinations. Now, the CDC does not prefer any vaccination over the other, as long as the vaccine that is used is FDA licensed and it is approved based on age. So each of these vaccines have appropriate age that they should be used in. And also, I want to mention one more thing: is if patient is not, if you're not convinced that the flu did not give you the flu shot, did not give you the flu, then here's some other considerations. That it takes about 2 weeks to develop immunity, a full-fledged immunity against a full-fledged vaccine. So it's possible that you got the flu within that 2-week period. So you got the flu today, but maybe you contracted the flu like tomorrow or the next day. But like I said, it takes about 2 weeks to give your body the immunity that it needs. Also, as I mentioned, is that the flu shot protects you against 4 strains. Okay, so 2 type A and 2 type B. So it's possible that if you did get the flu, it may have been one of the other strains that are less common. And also, it's possible that the symptoms you had were just a bad case of the cold. So that could be the case as well. What are the special considerations of the flu shot? Like I said, the CDC recommends licensed, age-appropriate vaccinations, but if you are 65 years of age and above, they recommend a high-dose flu shot, or what we call flu block quadrivalent recombinant vaccines, or a fluad quadrivalent adjuvant vaccine. So adjuvant is they add a certain ingredient to the vaccination where it causes a better or a stronger immune response to fight off a flu infection. Now, who needs 2 shots? Children less than 9 years of age who have only received 0 or 1 shot in the past need 2 vaccinations. If a child has not received any vaccinations who is less than 9 years of age, they need 2 vaccinations. And that's probably more common now because there may have been less vaccinations that were given in the last 2 years because people were staying at home and practicing COVID safety measures. And so the second vaccine should be given at least 4 weeks after the first dose. And also I want to add that another population needs a second shot, and these are especially pregnant women in their 3rd trimester. Okay, and the reason for this is studies have shown that antibodies that are generated by the mother when they receive the flu vaccine, they are able to be passed on into to the baby. So if you give it at the 3rd trimester, then they'll be protected for the first few months of life, because remember, this flu vaccine is not approved for less than 6 months of age. And just on a side note as well, flu vaccine is safe also for breastfeeding mothers. Studies have shown as well that the antibodies can be passed on through the breast milk. So vitally important. So who should not get the flu vaccine? Once again, it's not approved for 6 months of age or lower, less than 6 months of age. And if there is any history of severe allergic reaction to the flu vaccine previously, if they have anaphylaxis, shortness of breath, then yes, do not give that. But I would advise you to discuss it with your primary care doctor as well. Now, one of the biggest questions is egg allergy. Is it a contraindication to receiving the flu vaccine? Now, the CDC recommends that people with a history of egg allergy who have experienced only hives after exposure to eggs should receive the flu vaccination. Now, if they had a severe allergic reaction or anaphylaxis to egg itself, not the vaccine, to egg itself, then it should be administered in a healthcare setting, either inpatient or outpatient, where a provider is available who can manage if there's any severe allergy. But in general, it's not contraindicated for those who have egg allergies. There was actually a study done that was published in 2015 in the Journal of Allergy and Immunology, where they took 288 kids who had atopic allergy to eggs. And of those 288, 115 of them had anaphylaxis to eggs. And what that study showed was after giving flu mist, which is a nasal flu shot, none of them actually developed any side effects that warranted any medical attention. They may have had localized swelling or pain or some GI distress, but it never caused any shortness of breath or any symptoms requiring them to see a doctor. So that's a quite significant study that was quite recent. So just to take home the point again is, if you have any concerns about egg allergy, it's safe to give it, but please, talk to your doctor as well, talk to your PCP. Now, another question is, can influenza vaccines be given at the same time as other vaccines, including COVID-19? Yes, absolutely. Especially the time when, COVID-19 is around, you can give it. I usually recommend giving it on both arms, one on one side and one on the other arm. Or you can also, at the same time you see your PCP, update your other vaccinations. You're there, you might as well just get them all. There's no problem with that. The only caveat to that is that if you do the flu mist, then you can give it with the other live vaccinations, such as MMR, but you should not give it, you should wait at least 4 weeks before giving another live vaccine. All right. But in general, the question is, yes, you can give it, and we've been giving it. I do recommend that when patients go to pharmacy to get their flu shots, get both COVID-19 booster, especially if you've not had the Omicron strain booster, and get the flu shot. So going back to the very basics of this, it's taking home the point is what we're trying to do is we're trying to save lives, trying to protect you and your loved ones. These studies here, they're all in the CDC. I'd encourage you to take a look at them. But in general, flu vaccines can keep you from getting sick with the flu. In 2019, 2020, flu prevented 7.5 million illnesses, 6,300 deaths. Studies have shown that the flu shot reduces severity in vaccinated patients who also get sick by reducing the risk of admission by 26% and decreasing the risk of death by 31%. It reduces the risk of flu-associated hospitalizations. It's an important preventive tool for people with certain chronic medical conditions. Helps protect pregnant people during and after pregnancy, as I discussed, and can be very life-saving in children. If you have an infant who's less than 6 months of age, you gotta make sure that everyone in your household is vaccinated. It's to protect them, to protect you, and to protect your infant. So getting vaccinated may also protect people around you as well. So it's not just us, it's just not just your family, it's protecting everyone that you might have close contact with. We've been rehearsing this for the last 2.5 years, and I want to stress the importance of reminding ourselves to do this. Everyday actions that can prevent the flu and other germs, and especially COVID-19. Washing your hands at least 20 seconds with soap and water. They've advocated maybe singing happy birthday when you wash your hands. And using a hand sanitizer with at least 60% alcohol. And especially if you're immunocompromised, if you are in that age range that you have chronic medical conditions, or if you're in those groups, I can't stress enough the importance of wearing a mask. It's still, very much, even more so now, important that we wear masks, especially those who are immunocompromised. So let's not forget that. But the biggest thing that I can advocate for is really getting your flu vaccine. But wear your mask, especially if you have chronic conditions or if you're in that high-risk group. Cover your nose and mouth when coughing or sneezing. That's vitally important. And disinfecting shared surfaces, phones, keyboard, doorknobs. It depends where you work. If you share same keyboard, if you work in the hospital, if you're a nurse, or it depends on what activities you do. And if you are sick, please avoid close contact with people who are sick and stay home when you don't feel well. And in general, increase your immunity. Be physically active. Try to exercise moderate exercise at least 30 minutes per day, 5 days a week, or at least 150 minutes per week. Get plenty of sleep. Eat nutritious foods, a variety of whole foods, different colors. They have their phytonutrients, and manage your stress. So all these things are really important to help increase our immunity, help protect you and your loved ones. I can't repeat how important that is. So once again, it's October. We are in the start of the flu season. We want to prevent a twindemic. We want to prevent these rises. We got to mitigate the severity of flu, especially this season. So let's do all we can to aid in that effort. So it's a challenge, but I believe we can do it. So once again, thank you so much to the Washington Healthcare System, the foundation, and also thank you to the crew here, Christy, Nick, and Bill. And with further ado, if you have any questions, feel free to ask.
Thank you, Dr. Porciuncula. We do have some questions. At what point, if I'm not feeling well, would you recommend I see my doctor?
At one point when you're not feeling well, I think at any time that number one, because I'm a family medicine doctor, establish care with PCP if you don't have one right now. But if you start to experience any symptoms that I mentioned, headache, cough, if you're around anyone who you feel may have the flu or COVID-19 or any other respiratory infection, or that they do have that, please see your doctor, because we can actually do some testing as well to test for both COVID-19 and the flu. And just in case you do have these symptoms, there are also medications such as Tamiflu that could be useful in terms of decreasing the severity of the flu. So honestly, if you have any symptoms, you're concerned about it, it's always better to be safe than sorry. So please see your physician.
Thank you. And the next question is, if I have the flu, how long should I wait before returning to work or school, or just being around other people in general?
The CDC says that you should wait at least, so it depends on your symptoms really, but you should wait at least 24 hours after the flu symptoms have subsided without taking any fever-reducing medications. But it also depends on how severe these symptoms are. I would consult with your doctor. Make sure it's not COVID-19 as well. If it's confirmed as flu-19, do a home COVID-19 testing as well. But if you're not feeling well, I'd advise you to stay home, but talk to your doctor and see when is the best time for you.
Thank you. And then the last question we have today is, if I'm out and about running errands, how often should I reapply hand sanitizer?
All right, that's a great question. There's no hard and fast rule on how often you should be applying hand sanitizer or washing your hands, but a lot of it is what you do. It's your activities. Are you cooking? Are you washing are you cooking? Are you cleaning? Do you have contact to other surfaces? Are you always using the keyboard? Whatever activities you do, if you're coughing, obviously wash your hands after that or use a hand sanitizer. So it really depends on activities, but it's always better to employ these safety precautions, washing your hands as often as you need to, especially if you feel that you may have a germ or a virus that you may have in contact with.
Okay, thank you very much. And this does conclude our program. Thank you, Dr. Porciuncula, for sharing all of this information about the flu and educating us today. It was great information. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.